This is exciting to me. Autogenous dentin graft and membrane. Here we're using, rather than using an allograft or a synthetic material from a bottle, I'm actually going to use the patient's dentin as my graft material. Well, why is that important? It's an autograft is normally we would take bone from the symphysis or from the ramus area. There's nothing better. It's the gold standard, right? The patient's own bone. Well, dentin has the same bone proteins, growth factors that autogenous bone would have. So in this situation, we have a situation where we're going to remove these grossly decayed teeth using the Golden Dent Physics Forceps, atraumatically removing these teeth. Now, it's imperative that we clean them. I'll scrub these teeth, and I actually will remove the coronal portion. You don't want any filling material, no composite, no amalgam, and no root canal, no gutta percha. So we'll scrub these teeth and remove all the artificial material. Any traces of decay I will remove, and we will scrub them and dry them before we put them in something called the Golden Dent Smart Dentin Grinder. So here we have our atraumatic extraction site, and I'm going to use my Orban knife from the Golden Dent grafting kit, and I'm going to expose the tissue both facially and palatally. To alleviate, I'm going to flatten that ridge to some degree. This is going to be a site for dental implants in the future. I'm going to use my bone file to flatten any spicules, and this is it. This is just an amazing machine. It's so exciting to be a part of this. So I'm going to take those dried teeth with all the decay and artificial materials away from it, and I'm going to put it in one of these are disposable chambers, these grinding chambers. And then again, Kurt Lawler at the end of the program can discuss the cost of all of this. But these are in a sterile package. They're one-time use. And we will turn on the device, and it will grind the components in a matter of about 30 seconds. And look at the amount of graft material that I was able to harvest from these root structures. We'll then clean this. We have to clean the particulate dentin for about 10 minutes. So we'll pour it into a little glass container and add 0.5 sodium hydroxide material, and we let it sit for a little bit. And then we will pour off the excess. Here we're adding the material. We'll pour off the excess, dry it with a little gauze, and then we will rinse the particulate for about 3 minutes using a buffered saline solution. And again, it'll soak. So the whole entire process maybe will take 15 minutes, but my team will do that while I'm preparing the surgical site. It looks just like what you poured out of a bottle and wet. So I'm taking my dentin particulate graft to the site, packing it, and then I'm going to cover it over with my membrane passively as we've demonstrated before, and we're suturing. Now, what's remarkable about this? Okay, I said that with the Osteogen plug, I will wait 3, 4, 5 months. With our allograft material, I'll wait 4 or 5 months. Well, this is healing around that site, and I will actually go back and place my dental implant in about 7 weeks. So about half the time, and that's because this is part of the human body. The body does not have to change the foreign body, change it over to convert it to bone, because we have all the proper growth factors within the autogenous bone itself. So you can see, I did a CT for you. You can see after 7 weeks, we have a pretty decent turnover to bone. starting from the apical portion. I flapped the site again to show you that I was able, after 7 weeks, to place my dental implants very predictably into the site. Here we're suturing, 1 week post-op, and after a couple weeks, that tissue heals wonderfully, and I can go and load those implants in a very short amount of time. So I want to keep it simple. This is what I recommend. I think you should have an allograft product, 250 to 1,000 microns of mineralized cortical cancellate particulate. You can do it in a putty form if you find that more convenient, or a particulate, a powder form that you can wet with sterile water or sterile saline. I think you should have osteogen plugs. When you have the facial plate of bone intact, I don't think there's anything easier or more cost-effective than the osteogen plug. I think that you need a membrane. The EpiGuide membrane or the collagen membrane that we talked about are both excellent products to use. I don't really have a favorite. It's really what you feel comfortable using. And that's why coming to one of our courses where you can use the product, you'll learn what you feel more comfortable with. Autogenous, using the Dentin Grinder, is a wonderful product to use when you have larger areas to graft. And it's a lot of fun, and the patients really respond to that. They think it's high-end stuff. It's not expensive. You do have that disposable grinder, but that's not a very expensive product. So for those of you who want to try it, I strongly recommend that you discuss that with Golden Dent. The Smart Dentin Grinder is a pretty awesome alternative.
This is the Smart Dentin Grinder. I'll just mention this quickly. The initial investment of the machine with 6 uses, with the discount, it is around like $1,400. So there is a little investment to get involved with the machine. But what's really interesting is if you're doing multiple sites or a whole arch, or say 3 or 4 sockets, each time you do use the product, it costs you around $49 because it has a disposable chamber. You've got the cleanser and the saline wash, and then the glass dish. That's all disposable components. So that actually is a very affordable graft. If you put a couple molars or some anteriors or any mixture of teeth in there, you'll find that you have an abundance of particulate or dentin particulate. And it's interesting because you'll be able to do all of those sites for a cost of only $49, where if you were going to use an allograft, it'd be much more expensive. So it actually is an economical product beyond the clinical benefits that Dr. Kosinski just showed. So something to take a look at. There's literature on it and some different information available on our website, or if anybody wants to see some specific articles, feel free to contact us and we can forward those on to you. All right, the Dentin Grinder. If somebody has a question, I guess, if one tooth is extracted, is that normally enough particulate to fill the socket? So how much particulate or dentin graft, I guess, is generated usually?
Well, Kurt, maybe you can help me out with this. I think it's like 3 times. Yeah. It'll fill 3 times. It's amazing how much particulate you get from one root.
Yeah. In our experience with documenting these cases or looking at any of the literature, is you'll have more than enough of the graft material that you likely will not use. The article is going to say, or the guidance on the machine is going to say usually 3 to 4 times the volume of the tooth in particulate. So even if you are extracting 10 teeth, it's very likely the dentist might only put 5 in there because he knows he's going to have more than enough graft material, so you don't even need to use all of the teeth. And so, for example, like Dr. Kosinski mentioned, if one of the teeth is endodontically treated, or maybe has some artificial components you don't want to use in the grinder and the graft, you don't have to use every tooth. If you even have 1 or 2 decent teeth, I mean, that's going to produce enough graft for the whole procedure, very likely. All right. Another question on Smart Dentin Grinder. It says, you mentioned about scrubbing the teeth before placing them in the grinder. So it says, are you scrubbing the teeth before you place them in the grinder, and then it asks a question about a different question would be, are you concerned if there's any bacteria still left, or will the cleanser still take care of that in the cleansing process?
And well, thank you for answering that question, questioner. You remove all the artificial material, you remove any decay, but even if you left a little bit, the cleanser will decontaminate the entire site. And obviously you're putting the same material into the patient that you took the tooth out of. So.
Okay, just go with that. I'll respect everybody's time here. I'll go through just a couple. There's still quite a few, and we can answer some of these separately. Let me see here. Somebody asked, I guess just to clarify this again, do you remove the crowns or the enamel when using the Smart Dentin Grinder?
I think the literature, you don't have to, but that's what I've been doing. I'm using the dentin rather than the enamel would be very hard. It would be more like cortical bone. So it's going to take much longer to resorb. And what I want is I want a faster turnover of bone. It's just stimulating because of the all the growth factors in the autogenous material are present. So we get faster turnover with this product. So I remove the enamel. That's me.